வணக்கம். இன்றைக்கி நம்ம பார்க்க போகிற டாபிக் வந்து சர்ஜிக்கல் ரிமூவல் ஆஃப் இம்பேக்டட் மேண்டிபுலர் தேர்ட் மோலார். ஸோ நான் வந்து ஸ்டெப் பை ஸ்டெப் கைட்லைன்ஸ் வந்து உங்களுக்கு கொடுக்க போகிறேன் ஃபார் ஆல் த டென்டல் ஸ்டூடெண்ட்ஸ் அண்ட் ஓரல் சர்ஜிக்கல் ட்ரைனிங்ஸ். Now first and foremost is the patient positioning and the instrumental setup. This we all know. For the proper chair positioning to be followed, in case of mandible the occlusal plane to be parallel to the floor, and in case of maxilla 45 degree to the floor, and we have to arrange the instruments in a proper sterile towel, followed by scrubbing, gowning and draping in the very sterile manner. Coming to the palpation of the anatomical landmarks. In case of mandibular third molar, we have to know the anatomy very well. Pterygomandibular fold and its raphe and external oblique ridge to be palpated, and then the coronoid notch in case when we are giving the INB block. These are the landmarks, and the lingual shelf to be properly. We have to know all the landmarks before starting the procedure. Then comes the flap designs. We have given the INB block, then we are going to wait for 2 to 3 minutes, and we'll start with the procedure. Flap design, that is of two types, that is envelope or triangular. This is most commonly used. In case of envelope flap, it extends from posterior to the impacted tooth and to the first molar. This has a fewer complications, and also it heals very fast. In case of triangular flap, there is an additional releasing incision anteriorly. We have to give anterior envelope same as envelope, and anteriorly we will give the additional releasing incision. That is 6 mm down the buccal sulcus anterior we will give, and in order to we have to avoid the extending incision posteriorly in a straight line, because it will lead to the risk of injury to the lingual nerve. Then comes the bone removal. So instrument of choice, we all know that handpiece of higher speed electric drill has to be used with a copious irrigation in order to avoid the emphysema risk. And guttering method, we have to go deep and vertical guttering buccally and distally in order to preserve the buccal plate. So we have to buccal bone removal minimum, and also we have to protect the lingual nerve. So the two sectioning and delivery. Always cut to 3/4 of the width of the tooth, and plan the vertical cut and split with the elevator. So sectioning reduces the operation time. நம்ம செக்ஷன் பண்ணுறதுனால நம்மளால் சீக்கிரம் நம்ம டூத்தை retrieve பண்ண முடியும், and also to avoid the bony removal excess. Always keep cuts within the tooth structure, so நம்ம lingual or inferior alveolar nerve we can protect it. Approach by the impaction types. In case namak mesoangular impaction irundhuchna, which is very less difficulty level, and we can elevate it mesially, and tooth rotates distally. In case of horizontal impaction, section the crown first and deliver the root in the vacant space. In case of vertical impactions, remove the distal bone and section the distal crown half first, and then remove the tooth. And in case of distoangular, it is most difficult one. Adukku nama create the buccal and the distal trowel, adukaprom elevate it upward and distally. Coming to last step, that is debridement and wound closure. We have to remove நம்ம follicles. After removal of the tooth follicles இருக்கும், remnants இருக்கும். We have to thoroughly irrigate பண்ணிட்டு அதுக்கப்புறம் follicles எல்லாமே remove பண்ணிட்டு, and bone shapes, any fragments எல்லாமே remove பண்ணிட்டு smoothen the bony edges, and then we have to go for the closure. First suture எப்பயுமே distal to the second molar இருக்கணும். Avoid over tightening and leave the vertical incision unsutured. So main principles to be remembered in பார்க்கும்போது minimum lingual interference. ஸோ இது என்ன பண்ணும், lingual nerve injury பண்ணுறது reduce பண்ணுது. அதுக்கப்புறம் adequate bone removal நம்ம பண்ணணும் ஃபஸ்ட்டு. never force elevation. நம்ம in order to mandibular fracture நம்ம ப்ரிவெண்ட் பண்ணுறதுக்காக ரொம்ப ஃபோர்ஸ் கொடுக்கக்கூடாது. இதுக்கப்புறம் ஃபாலோட் பை copious irrigation. இது எதுக்கு ஹெல்ப் பண்ணும், prevents the dry socket and delayed healing. So thank you so much for watching the video. Do subscribe this channel for more contents. Thank you.